welcome back to the show. Now, yesterday, Jaine was with us to discuss all the controversial things about vitamins, and today she is here to talk with us about the Natural Health Products Bill. Welcome back to the show, Jaine.
Thank you, lovely to be back. Yeah.
Yes. Now, is this something that you are actually in support of?
Well, the New Zealand Society of Naturopaths supports the idea of looking at a bill and getting something that works for New Zealanders, so very much in support of that. But there are some issues with this new products bill that we feel need to be revised and looked at more closely.
What are some of those issues?
Well, one of the things are there's a proposed list of permitted ingredients, so only the ingredients on a particular list will be allowed. So we've got a bit of a problem with that because we feel there are some natural products that don't actually fit into that proposed list. So whereas we're quite happy about having a list of prohibited ingredients, we think that would be quite a good idea and safeguard the public. The proposed one we feel would be quite limiting.
So would you say it's blanket legislation?
It's not proposed to cover all health products. There is some questions because what they're asking at the moment, the government is asking for the public's opinion on this proposed bill. So it's very much a consultative document. But there are some limits there. There are some products they're saying, well, we don't have to include them. What ones don't you think we should include? And the Society of Naturopaths believes we shouldn't include in that bill homeopathic remedies because it's difficult to legislate for them to say this product isn't allowed in it or this is, because they're used in such tiny amounts, often amounts that aren't even measurable by laboratory conditions. So to say you can't have that one when there's say infinitesimal amount, a bit ridiculous really. So so the homeopathic medicines, also the food state supplements, because they're made in quite a different way, we think should be excluded from the bill or looked at slightly differently. I
imagine it's difficult to know where to draw the line with some of these things as well.
Yes.
And how do you feel, like in terms of giving people confidence, like what the bill is proposing? What is that going to do for people's confidence?
We think it's a good thing that there'll be higher regulations on New Zealand health products as a whole. We think that's good. So that's going to give people confidence, and we want the best, definitely, for all New Zealanders. And for their health to be at the best. But the thing is, the cost of this bill and the cost of implementing and running the bill is actually very high. Now, that cost will be borne initially by the supplement producers, but of course, that's going to be a knock-on effect for the consumers. So the consumers are going to have a higher price goods, which might put them out of the price bracket for a lot of New Zealanders, and will limit choice, and we think that's not a good thing, really.
It certainly throws up a lot of other factors, doesn't it, into the mix?
Yeah,
I can see that.
And other things that we're concerned about are the therapeutic claims. At the moment, for natural health products, nobody is allowed to make a therapeutic claim. Now, the new bill proposes a little bit of a change there. It says, well, low-level therapeutic claims can be made, which sounds all right, except we believe, Society of Naturopaths believe, that there's so many natural health products that actually help quite serious conditions.
That's right.
And we definitely don't want to say and have written on a product, this will help such and such a condition if there's any evidence for it. So we'd like to be able to have claims on products as long as there's evidence to back it up, but not be limited to just a cough or two, or I don't know, something very minor.
I absolutely hear you, Jaine. Yeah, I know exactly what you're saying there. And in terms of policing the whole thing and monitoring it, how difficult is that going to be?
From the present proposal, that looks like it's going to be quite difficult and quite costly. The fines proposed are enormously high if somebody does, go against the products. So, but we think policing it may be difficult.
And what can individuals do to protect themselves against illegal substances?
It's at the moment it's difficult because our regulations aren't high enough. Again, we'd say visit a registered naturopath, contact the Naturopathic Society, visit the website www.naturopath.org.nz, and also look carefully at the ingredients in the bottle and look for more natural ingredients. But it is difficult at the moment. The other thing we'd encourage the public to do, I know we're a little bit late in the day to encourage the public to do, but have a look at more proposals for this bill. The submissions have to be in on the 17th, which I know is only a couple of days away now.
Yes.
But it's still possible. Look on the Ministry of Health website, and there's a submission form that anybody, any individual at all, can put a submission in to say what they think and what their opinions are, and that'll all be taken into account. And I think watch the developments really, because this isn't the last we've heard of it. I don't think it'll be made into a bill yet. So keep involved, keep listening.
Right. I love the way you say that, to keep involved, because it certainly opens up a world of things. And Jaine, it's just so wonderful to hear your passion coming through about it. This is what the world needs. Thank you so much for coming in today.
Oh, it's been a pleasure. Thank you.
Okay, and up next we are going to find out, does Hamilton need a commuter service to Auckland?